by the facts, hospitalization rates are increasing dramatically across the world, across the nation, and across this state. You see where we are now, and you see how quickly the increase has been. And this is the ultimate cause for concern, right? The ultimate cause for concern is an overwhelming of the hospitals. With the hospitals, the situation in the hospitals is better than it has been in the past. Compared to the spring, we have 30% fewer people in ICU. We have 50% fewer people intubated. The length of stay in the hospitals has dropped dramatically. The length of stay was on average 11 days in the spring. It's now down to 5 days. The medical community has made the most progress over the past few months. Not only the development of the vaccine, but therapeutics and how they deal with this disease. And that's what you see in the reduction of the length of stay. And that's what you see in the death rate. We had a 23% death rate in the spring. That is now down to 8%. This is probably the most informative data. Where are the new cases coming from, right? You want to know what's generating the new cases so you know where you can stop them. The troubling information in this is 74% of the new cases are coming from household gatherings, living room spread. In many ways, you can understand what happened. You close bars, you close restaurants, you close theaters, you close stadiums, you close mass gatherings. Where do people go? They go home. Come to my house. They'll go over to Robert's house. We'll invite our friends. We'll invite our family. Compound that by the holiday season, which is a natural come to my house, my family, my friends I know will be safe. That is what is driving these numbers. You get past the 74%, healthcare delivery, which is incidental to the provision of service, right? These are in hospitals, et cetera. Then higher education, colleges, which we have been battling. This is partially college students going back and forth. This is partially college students who at that stage in life are superheroes, and they don't believe that they're going to get infected. And if they get infected, they're going to be able to deal with it. We've been dealing with colleges. Education employees, restaurants and bars, 1.4%. But you're now down to small numbers, basically, right? Travel, vacation, we've had quarantines, but people coming in, that is an imperfect system on travel. That's about 1%. Sports is basically school sports. Public sector, police, fire, EMS, military. Now, a big part of this is people who just by their job are exposed to the situation. EMS workers, National Guard people who have been helping. Police, fire, they're out there all the time. I've said repeatedly, police especially, they need to wear masks. It's the law and it's smart. It's both. Transportation, private transportation, people who are in limo cars, calling cars, as well as public transportation, manufacturing, religious activities, construction, retail, professional services. Elementary school, 0.49. High school, 0.46. Prisons, correctional, 0.4. Middle school, 0.19. Auto dealers, car rentals, 0.16. But we're getting to very small numbers here now. Auto dealers, car rentals, and then hair and personal care, which was much worse earlier on. Wholesale trade, building services, real estate, arts, entertainment, gym, agriculture, hunting, forestry, child care, power utilities, accommodations, media production. But you're now in very, very small numbers, right? So stop the spread where it exists and stop it where it's being generated, but don't waste time on areas that are not generators.